Welcome to another episode of The Granite List Live, where we explore all things employee benefits and human capital related. I'm your host, Sally Pace, and today I am joined by Vince Lewis, who is the Chief Sales and Marketing Officer at UME, Underwriting Management Experts. Vince, thanks for being here.
Sally, thanks for having me on here. This is a pleasure and an honor. So thank you again for inviting me.
Well, likewise, I'm really excited that you're letting us be kind of a mouthpiece for some of the really incredible programs, progress you all have at UME. Before we dive into what's new and what's coming next, can you talk to the audience a little bit about who UME is?
Sure. Underwriting Management Experts, UME, is a managing general underwriter of medical stop-loss insurance. So we're a full-service stop-loss provider based in Lansdale, Pennsylvania, which is just outside the Philadelphia area. We've been in business since 2015. We are one of the largest, if not the largest, privately held MGU still out there in the market, considering all the craziness that goes on in our world these days. We really pride ourselves on creating disruption through independence, flexibility, and innovation. We have multiple self-funded solutions for producers, whether they be brokers or TPAs. We offer traditional stop-loss products as well as a level-funded product called Max Advantage. We do work in the MEC space as well as student medical. We offer captive opportunities, risk-sharing opportunities. We own our own reinsurer. We represent currently 3 carriers, Gerber being our lead carrier, in addition to Garden State Life and Standard Life, which are both part of American National. And we really feel that we are well positioned, especially with all the things going on in the market, in the stop-loss market and in the world of employee benefits these days, to take advantage of what we feel is coming down the pipe.
So let's talk about what that is. I love that you described yourselves as disruptors, you're innovators, and I have a feeling you all have big plans as we head into 2025. So what's next?
Well, as I had mentioned previously, Sally, we have capabilities in the captive space, and we are looking to early next year launch our captive product called Sapient Health. Sapient Health, we feel like with everything that's been going on in the world of employee benefits, I mean, you see it in the headlines, you see the employee lawsuits against employers, you see all the issues with the No Surprises Act and transparency and all the craziness is going on right now. And I think the market, employers in general, are screaming for a solution that, one, will help them create cost savings for themselves, 2, create some different risk financing vehicles to be able to better pool and analyze their risk, and create some transparency, which will allow them to be able to actually see what's going on in their benefit plans, be able to see how they can allocate funds differently, and actually know what all is being paid, I think, which is also a big issue. So Sapient really extends ownership in multiple ways. Again, we're an employer-owned, fully integrated, and fully transparent self-funded healthcare solution. And that's basically what we tout to do, and that's what we feel is our value proposition, because we're going to tailor-make ownership, to extend ownership through creating and designing health plans tailored to meet the diverse needs of employers. We also, want to have the point solutions that actually will help save money, combining that with the abilities of the risk financing mechanism of a medical stop-loss captive. If they had a baby, that would be Sapient Health. That's what we feel this is. So we're giving them access to employer-owned captives and giving them the mindset to kind of spread and stabilize risk associated with large claim exposure, and enables the employers to benefit from surpluses generated by the captives with a community of learning and best practices amongst their peers as well.
So Vince, help me. I think most of our audience is at least familiar with the captive concept. It's a risk tool, but talk through who you think is going to be attracted to this. What type of employer, what type of consultant?
Well, let's start with the employer. I think the type of employer that's going to be attracted to this is likely the small to mid-size employer, likely who's been fully insured for a number of years. This is one type of customer anyway, that's been fully insured for multiple years, who knows their plan has been running well, who've been getting, but in spite of their plan running well, are getting increases from the fully insured carriers year after year after year. And so they're like, hey, that's money I could be, retaining for myself and applying cash flow savings through a self-funded plan. So I think that's one type of employer that would be interested. The other type of employer is a current self-funded employer, whether they be small, mid-sized, or otherwise, who may already be self-funded, but maybe looking to take their risk appetite maybe another step up and actually wants to pool risk with others who want to align themselves with like-minded people to be able to create opportunity for them to even save more money and be able to create, again, additional cost savings and certainly additional economies by working, again, with other like-minded employers. The type of broker I would say really is going to be a broker who's progressive, who's forward-thinking, who not necessarily is looking to do kind of just the flavor of the month, because you could make an argument that captives are kind of flavor of the month right now in our industry, but actually looking to take it a step above and want to be progressive and be able to bring, not just do whatever they feel like doing in terms of, just putting together cost saving solutions that may not necessarily be effective, but working with vetted, proven solutions that will be able to move the needle in the healthcare supply chain.
And you've mentioned captive solutions, plural. I know we've had a couple of discussions about what the vision is as you grow into the space. Can you talk a little bit about what some of the key features are? And it's not just one captive tranche, it's multiple. So can you talk about that a little bit?
Well, as I had mentioned previously, is one of the pillars of our value proposition is flexibility, and we want to kind of continue that into the creation of Sapient Health. So we've got a lot of flexibility in terms of the type of captive options that a producer can pursue. We have, for example, if an agency, a producer wanted to create their own captive from scratch, we have the capabilities of doing that. If they wanted to move business from an existing captive arrangement that they're in into our captive through Sapient, they could do that as well. I think one of the really attractive features that we're looking to bring on is a level funded captive, which I think will attract a lot of smaller employers that are looking to transition into self-funding. The small group market, fully insured transition market, is the fastest growing market in self-funding. It's not so much in the larger employers anymore, but the smaller employers are where you're seeing significant growth in self-funding. So I think that's going to be very attractive to folks. And we also have some things that are specific to certain homogeneous groups, specific to certain types of delivery systems, such as RBP or direct primary care, or certain areas that they may want to specify on, and we can create solutions around a specific type of business that they want to pursue as well. So again, we want to offer as much flexibility as we can here and not be as rigid as maybe some of the other name brand captives out there.
And Vince, I know UME has a really terrific reputation in the marketplace around how transparent you already are and how important that is to the UME team. How will that spill over into the captive space with Sapient?
What we want to be able to do, again, as part of the value proposition, we want to be fully transparent. I mean, let's face it, transparency is currently a potential tool in helping employers make informed decisions with having good information. And so why not turn it into a strategic asset for not only the employer, but the broker? So, but it doesn't mean just having access to the cost and quality of services, but knowing where every dollar in the plan is being spent. A lot of times people talk about this word transparency, but a lot of times it's more than just a word. It actually is what it means. It means all costs of the plan are disclosed. So it takes on a lot more significance. That is being a true fiduciary and a shepherd of the plan. So we think brokers who believe in this will prioritize the need of their employees and the employers above theirs. So we want to exceed standards above whatever the current transparency laws should discuss. And so we're talking about disclosing all costs of the plan, providing significant data so they can make good decisions, overview and improving of point solutions. We have multiple point solutions that we work with currently. Those will be reviewed on an ongoing basis to determine efficacy, and so we'll make adjustments as need be. Having open dialogue with the advisors to create a culture of trust and partnership, and just leading from the front. I mean, that's what we want to do. We want to manage a solution that's sustainable and adaptable for employers and brokers.
And I've heard you speak at national conferences before about the importance of trust and transparency, but along with that comes a level of education that, frankly, in the marketplace sometimes gets overlooked. So do you all have plans? Can you walk us through how Sapient Health will deal with the educational component?
Yes. So it starts with a process, Sally. I mean, the first thing we want to do is we want to, recruit and vet potential advisors, making sure that we're working with people who are passionate about making a positive impact and delivering results. And that goes for not only the brokers that we're working with, but every vendor that wants to work with us. They will be vetted completely and thoroughly before being admitted. So let's say a potential producer had a point solution they wanted to bring in, they would have to be vetted by us first to make sure that they could meet the commitments that we've set. And from that point, then we would continue to train and educate the advisors and employers to provide them with, knowledge to ensure they have the knowledge and skills necessary to navigate the complexities of what's going on in healthcare these days, and opportunities for employers to help them understand what's going on and help them make informed decisions. I feel like because we're vetting each broker that we work with, and because we're going to give them the tools, we don't feel like it would be necessary for us to have to go out and make presentations along with the broker. We're going to empower them with the knowledge needed to be able to go forth and express and articulate that message.
And you mentioned point solutions, and I certainly don't want to open a Pandora's box, but we have a large portion of our audience is the point solutions in the benefits arena. So if there is opportunity to get in from the ground up, what does that process look like?
Well, it's pretty simple. If there is some interest in coming on board as a point solution, they can certainly reach out to me. We got a bunch of different point solutions now versus related to reference-based pricing and direct negotiation and network access, PBMs, claim oversight, utilization management, disease management, you name it, it's in here. So if you feel like you would like to be a part of what we're doing here or want to hear more about what we're doing, feel free to reach out to me and we can have a conversation. And got a lot of the national conferences coming up here shortly. And so we'd love to have some conversation around that or have some discussion there. And then we can kind of see where, and we can kind of take it from there.
Perfect. This will be before your fall road show of being a traveling warrior over the next couple of months. I know you've got a very packed schedule, and I know that the audience that has met Vince Lewis can vouch for the fact that for sure, if you don't know, you don't know who you're looking for, find the sharpest dressed man in the room. That will be Vince. So
you're too kind.
We'll give them a chance to hunt you down. Okay, so backing up, for the broker consultant community, that's really your primary target audience to help them help their clients. Those that are listening, they do want to take a next step. They're curious about how they can better understand the different offerings under Sapient Health, how they can take advantage of it. What's the best way for them to learn more and to reach you?
The best way to learn more, I would say it would start probably with a conversation. So again, I would have them reach out to me directly at dlewis@umexperts.com, LEWIS, not LOUIS, because that gets confused sometimes. And we can set up a call and have a conversation around what we're doing here with Sapient. And if there's additional interest, we can kind of start working down the road of getting them on board as an approved advisor and get things kicked off. We're looking to launch this fully sometime early 2025. That is the plan. There may be unique circumstances that might be out there when we're open to listening to those, but the overall goal is to have this up and ready to go first quarter 2025. So we're making great progress toward that, and we're very excited about when we get that up and running. We're super excited about it.
Well, we at the Granite List are very excited too. Thank you for letting us be part of your launch party. And we can't wait to watch how it grows as we head into 2025. We have no doubt that the success that UME has enjoyed in so many other business lines is going to carry over to Sapient Health. So Vince, thank you for letting us help share that message today. And thank you also for being part of the Granite List community. We're really proud of that partnership. And thank you to our audience for tuning into another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.